If someone had told me that massage therapy for your child with cancer, I would have never put the two together.
It really feels like they're pulling the pain away.
We seem to have lost some of the skills that we used to be naturally born with.
It's kind of like a mother's touch.
Touch is a way that we communicate.
To be able to touch is to be able to help heal.
The Department of Holistic Health at Children's Hospital Medical Center was developed in response to a strong interest among parents and staff about the benefits of holistic therapies for children. Our mission includes patient care, education, and scientific research that create new knowledge about holistic health. Part 1 of this program series provides an overview of holistic health care and therapeutic massage for children. It explores the connection between holistic care and traditional patient care and presents the benefits of massage. Part 2 of the series provides basic massage instruction and a 30-minute massage-along segment for patients and their families.
Touch is a native human element. I mean, everyone needs to feel touch. It's necessary for sick children in particular because too frequently they're isolated from touch because of their illness. Parents are afraid to touch them, or the child doesn't want to be touched because they're afraid it will hurt. Holistic care is the idea that a person is more than the sum of their parts. Children's Hospital has always had this idea of family-centered care, or bringing in the patient and their families when they deal with sick children. But holistic care marries with that very well, in that what we do is we look at a child and we think that you can't just look at them as their disease or as what's wrong with them. You need to bring to them as well the spiritual, the social, the emotional things that are contributing to that illness, that are contributing to the way that they feel, and you have to address all of those in order for a child to become fully well.
And integrative medicine, holistic care, alternative care, complementary medicine all mean the same things. And that is that this is a group of techniques that are added to the traditional American mix of drugs and surgery to provide complete care for the patient.
Holistic health therapies include acupressure, aromatherapy, biofeedback, craniosacral therapy, guided imagery, healing touch, light therapy, meditation, music and sound therapy, relaxation therapy, and therapeutic massage, which is the focus of this program.
The physical act of touching is just an important way that allows people to connect.
So massage therapy in particular we brought to the children because it has so many physiological benefits. But in addition, it gives the parents and the staff a way to touch the child that is not threatening. It's a way of communicating to the child that they're safe, that their body is still capable of giving them pleasure, that they can relax, that they can enjoy life, and that life is good.
Massage in no way should replace traditional Western medicine. I believe it complements it in many ways. Number one, it tends to be calming and reduce anxiety. I think it would be beneficial in reducing pain, but it is in no way a replacement for any traditional Western therapy.
I think it's very important that a family work closely with their primary care provider or the physician who manages their child's illness to let them be aware of what they're participating in and what they're doing, so that that physician has a complete picture of that child's treatment.
We initially discussed this as well with Julia's oncologist and discussed what we were looking at doing while actually doing this while she was taking her therapy. And the doctor said there was not a problem. She encouraged it. She said we've had a lot of good responses from other families that have found it to help them relax and kind of be able to handle the added stress.
I would be most interested in the benefits or the results of a massage program or some other intervention that a patient of mine was participating in. In one way, that's how I learn about the benefits of therapies. It's certainly how I follow my patient's progress. And in another way, it helps me, again, keep track of the patient's overall picture and how they're progressing.
The child who is ill has a day that's centered on anxiety and pain. Their day's focus is where it hurts, why it hurts, and how much it hurts.
Well, he had a lot of headaches when he was in the hospital, and he just couldn't seem to get rid of the headaches, and he couldn't seem to get any good rest.
I was really scared, tensed, and I still held my muscles tight, and it took her to get up to my shoulders, and I just kind of let go because it just made me feel at ease, like okay, it's kind of like a mother's touch.
There's quite a bit of empiric research that supports the benefits of massage.
Reducing muscle stiffness, improving joint mobility, improving the flow of oxygen to tissues, which then therefore helps cleanse certain toxins and improve lymph flow in certain areas, are all proven benefits of massage.
Massage has been shown to enhance growth, to decrease pain, to decrease anxiety, to diminish depression, and also to enhance the immune response.
It's scary at the hospital for some kids because some of them don't know it's coming. All they know is they're in the hospital and they want to get out.
It is very stressful coming into a hospital situation. Just the whole admission process. That brings about a lot of stress that if we just deal with the disease itself, we're not going to be able to really help the patient. We have to get at some of those stressors.
The psychological benefits of a massage program may be as, if not more important, in my opinion, than the physical benefits. The parent's active role in a treatment program with their child through massage is, I think, a very important component for the parents. I think all too often parents are expected to be on the sidelines in their child's care and hand over that care to therapists or physicians, and this allows them a very direct role in that care and treatment.
It's something that, first of all, can bond parent to child. If the parent is one who is offering this to the child, then the parent becomes a much more integral part of the healing process.
So when you can reestablish touch in a safe and caring way, you reestablish that communication of caring and giving and nurturing that the child needs so badly when they are ill or sick.
Many cultures have used massage throughout history. As far back as 3000 BC, the Chinese were including massage and movement in parts of their healing practices. Romans, Greeks, Japanese, and in India, they've all included massage as part of their treatment program. Massage is not complex. There is no right or wrong way to do a massage. It is primarily what feels good to your child as the receiver and what you're comfortable with as a giver.
For any chronically ill child who might be participating in a massage program, there should be some thought given to whether or not they have medical equipment, such as a feeding tube or a breathing tube that could become dislodged or moved during a massage therapy. There should always be consideration of a recent area of trauma or of injury that might be undergoing active healing at that time.
Touch is a way to communicate between everyone. So in our culture, too frequently we don't touch, but it's the way that we can communicate with parents who are in distress, with people, with our friends, the way that we can tell them that we care.
I certainly believe that not just ill children or ill adults can benefit from massage. I think that massage and touch are wonderful things to incorporate into the overall health program for any individual.
Do we know everything that we should know about healing? No, I don't believe we do. I think we're learning more every day. We're learning the importance of touch. We're learning the importance of the spiritual aspect, the emotional aspect. All those things tie together. Nature versus nurture. No, we don't know those answers, but we need to keep exploring and not leave out any possibility.
To learn more about holistic care and therapeutic massage, contact the Department of Holistic Health Services at Children's Hospital Medical Center, 513-636-2463.